Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. In this week's video, let's take a look at how you can heal asthma with natural and effective therapeutic tools. Asthma is a common problem and it affects about 25 million Americans, especially children and teens. Here in the Northern Hemisphere, we are getting ready for the fall season, and this is also the time when I see way more asthma cases in my practice Medica Nova. Overall, the rates of asthma have been increasingly steadily over the last several decades. But rather than always refer to your antibiotics or classic bronchodilators, why not try a more holistic approach with less treatment side effects? Enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs ups and likes. It helps me with the algorithm of the YouTube videos. So what is asthma? Asthma is a condition characterized by difficulty breathing and narrowing of the airways leading to the lungs. Can be also the nose, nasal passageways, mouth and larynx. Asthma is a type of chronic obstructive pulmonary disease. We call it COPD, and it's also related, of course, to allergies, whether seasonal, environmental or food related. And the characteristic of asthma is that the symptoms actually tend to occur quite suddenly, so out of the blue, in response to the stimuli that irritates now the immune system and the air passageways, and that's what we call an asthma attack. So what are the symptoms? Well, first of all, you feel like coughing or sneezing. Others have a wheezing sensation, and it's a sound which emanates from your chest when you try to breathe. You feel like running out of air as you try to speak or to inhale. Children maybe have an asthma attack due to exercising and sports activities. There may be pressure and tightness right in your chest, poor circulation and oxygen supply. Some maybe experience even a discoloration, like a bluish purplish color of their fingers and toes, feeling lightheaded, dizzy and weak. There's an anxiety maybe involved, such as sweating with it and sort of like rapid heartbeat. Because you can't breathe, so of course you feel worried. The symptoms can be similar to an allergy attack. Maybe you have a runny nose, watery and red eyes, sneezing, itchy throat, or the allergy attack can lead to an asthma attack. Others experience maybe swollen lymph glands along the neck, or a dry mouth because they breathe more via the mouth rather through the nose. What are the causes? There are many different theories, of course, because there are many different triggers involved. So there can be toxins and irritants, either both from the environment or spending a lot of time outdoors. So the primary cause is more, but there are other factors, and that include maybe definitely poor nutrition, pollution, antibiotic abuse, autoimmune disorders, or any medical disorders that affect the lungs. And of course, it can be the genetic susceptibility. So if you have a family member where there's asthma predominant, you are more affected with it as well, or even high amounts of stress. There's also a very strong correlation between skin ailments and asthma. So if you have a child and there's maybe a diaper or nappy rash involved and it was suppressed and there was asthma in the family, it is not unlikely that when the child is 4 or 5 years old, suddenly the asthma comes about, because the lungs and the skin have a direct relationship. And when you treat then the asthma and it heals, the skin eruptions will occur temporarily because they need to come up to the surface to be faced and to be healed. So for some adults, asthma symptoms are caused by exposure also to chemicals, pollutions during work, can be dust or debris. We call it occupational asthma then. It talks about 15% of all the cases. But did you know that asthma is actually quite rare in remote areas of Asia and Africa? It's much more common in industrialized countries, Western nations, where people commonly eat inflammatory and low nutrient diets. So lifestyle changes, behavioral changes is a huge factor here in healing your asthma. What are the conventional treatments? Well, most of the time you will be prescribed anti-inflammatory drugs, steroids maybe, inhalers, bronchodilators, to help control the asthma attacks and prevent, of course, emergencies and complications. And I do say they have their place, particularly in emergencies, because they help you to open up your airways. But some research even suggests that the inhalant albuterol medications, which you know so well, can actually alter the genes in children and can make future asthma attacks even up to 30% more likely. So there are drawbacks, and I really encourage you to do your research on the internet about the medications you are taking. If you are interested in a health consultation either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. So book your appointment today. Let's move on to the second part of this video, food for thought, or the metaphysical meaning. Let's take a look at the energetic patterns behind the expression of asthma. As with all of my videos, let's look a little bit, within, on the mental and emotional aspects as well, and see what makes you feel that you're not able to breathe in your life. What stops the air supply, right? Is it a person? Is it a situation? Is it your work situation? Whatever it is, let's take a look. Let's be courageous, right? Because only then we have sort of long-lasting cures, which actually stand its ground. So according to Chuck Martell's references, he educates us that asthma is a respiratory illness characterized by breathing difficulties that can even lead to suffocation. So it's all about breathing, right, in the natural rhythm. When an asthma attack occurs, the reaction of the immune system to the allergy-causing substances is so strong that it can block the body's respiratory system, leading to wheezing and even suffocation. So what I'm about to share with you here, for some might be a little bit uncomfortable to listen to. You may experience some resistance, but try to be open-minded here and let the information resonate with your heart. Just let it in. I need to take life into me, so it's about inhalation, but I can't give it back. Exhalation, to the point that I start to panic. Right? I easily can inhale, but I exhale with difficulty. That's an asthma attack. So that my respiration, my ability to breathe becomes very limited and insufficient because I let out a minimum amount of air. What does that mean? It means I'm experiencing enormous anguish, fearing for my own strengths and wanting to run away even. I hide myself behind maybe a title, a diploma, an organization, any structure in order to feel safe. This way I feel choked by the power I give others, but still it is better than to become autonomous and take my responsibilities. There's a bargaining going on here. Do you see that? I can experience this situation as a child or as an adult. Now, if I'm a baby or a child and I'm asthmatic, I'm experiencing an anguish that resembles that of my parents, and it is horrible. I see that a lot with children with asthma cases. When there is disharmony within the home, parents start to fight, there's a divorce, the asthma attacks increase within the child. So it's a response, it's a defense mechanism here in order just to deal with this negativity. We resonate together in this, and I wonder if I have the strength to live. I wish someone would save me, would free me from this danger that is threatening me. I feel powerless, and I live according to others. Is it because I'm attached to certain people or things that I refuse to see, to the point that it is seizing me by the throat? Am I afraid of missing something, especially love? Thus, asthma is basically related to the action of suffocating. I feel held by the throat, walled in, I suffocate and I choke over a relation with a loved one or a situation. I refuse what is going on in my life, and I always desire something else. With this attitude, I cut myself off from any feeling of freedom. I believe I must live in the obligation of things instead of free choice. I'm constantly faced with an authority figure who prevents me from expressing myself and takes the wind out of my sails. I no longer feel free to speak and occupy my space. I can even experience disagreements that lead to quarrels and confrontations that poison my life and represent a threat for me. Because asthma attack, it's a threat, right? So something of a trigger, either pollen or a negative frequency around you. I'm so scared that it makes me gasp for air. However, this love, especially that of my parents, can be really stifling. I use asthma to attract love, attention, or a form of emotional dependency. As asthma is similar to asphyxiation and allergies, I may feel I'm being limited and letting my vital space be invaded by others. Being easily intimidated by other people's power, used to the detriment of my own, wanting to please and doing things that don't suit me, and going as far as suffocating to signify my inner revolt against some situation. As a person, I don't want to see my limitations. My self-confidence will suddenly be replaced with worry and anxiety and so on. You get the picture here now. With asthma, of course, there's the genetic susceptibility. There is the trigger when you exercise or damp weather, right? Or you're a smoker. There can be true tangible triggers. But there is also a story involved behind it. And often with children, I see that they feel dominated by one of the parents or both of them. Or there is a disharmony within the home environment. So what would be the positive affirmation? I accept to express what is stifling me and to occupy my space. I check to see if the ailment reoccurs periodically, right? Because asthma attacks come also periodically. And I change my mental programming accordingly. I now take my life in hand and give generously and quietly without forcing anything. I humbly recognize all I'm capable of, no matter how small, and I especially accept to open up with my heart and work with the integration process that fits with what I really need. Everything will work out for the best. I will be satisfied, filled with love and tenderness and enjoying normal, balancing breathing. I'm learning to love myself and to love life. I'm also learning to trust myself completely. On each inspiration, I feel more supported and reassured by life. And on each expiration, I learn to release control. I let go and go with the flow of life. I thus increasingly experience expansion and recover all the space that is rightfully mine. I learn to love myself in my inner unity. So let these words just sort of marinate inside you. Who is stifling you? Who is taking your space away? Which situation makes you feel like you can't express yourself? Just ponder a little bit. I'm sure you will find the answer. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I am coaching you to be well. Let's move on to the natural treatment protocols. As I already mentioned, there are several triggers here. Can be from the diet to the exercise to whatever stimuli. So the first point here, or pointer to healing, would be to really have a look at your diet. Because with asthma, they need a lot of antioxidants, nutrients to combat the environmental toxin, control any inflammatory responses, and also reduce the dietary triggers. So you want to bring in brightly colored carotenoid foods, which are all the orange and the red foods, because they're packed with antioxidants. You want to bring in foods which is rich with folate, all the vitamin B's, particularly vitamin 9. Also we have vitamin 5 and B12, all of that. Really is important here. Vitamin E, vitamin C rich foods, right? Powerful antioxidants which helps to detoxify the body. Foods which are rich with magnesium because it helps to relax the bronchial smooth muscles, so you get the air in more quickly. Bring in more garlic, onions and mustard seeds, which are natural antimicrobials, so they fight bacterial infection, improve overall immune system. Bring in more raw milk and cultured dairy. It protects the children from developing asthma and hay fever symptoms. Bring in probiotics, either in supplement form or in food form. Omega-3 fatty acids. As I said, I already mentioned vitamin B5. It really helps to help particular people who suffer from asthma and get this narrowing of the airways. Foods you want to avoid, of course, are all the conventional dairy, the added sugar, the trans fat, the refined oils, the gluten and the processed carbs. Children who eat foods fried in refined processed vegetable oils and consume a lot of hydrogenated fats actually are more likely to have an asthma attack. Children who are bottled fed with powdered and perosteroids, infant formulas, are significantly more at risk in developing asthma and allergies than those who are breastfed. The high sugar content, right, in many processed food contributes to the overgrowth of yeast and Candida albicans within your digestive system, also systemic system, and we don't want to have that. Hidden food allergies often trigger asthma attacks. So we have here pasteurized milk, I mentioned already, gluten, soy, eggs and nuts. Particular wheat and gluten and soy are present in a wide variety of foods. So always read the labels when you go to your health food store. Food preservatives are high on the list here. Avoid MSC, especially tartrazine. It's the yellow dye, so mac and cheese, it's often this yellow dye is in cheese, and also, as I said, pasta, sulfides or sulfur dioxide, just to name a few. All these hidden triggers can be part of your asthma attacks. And of course, avoid animal products which are treated with excess hormones and antibiotics. It doesn't really help. So asthma has a lot to do with toxins, right? Internal toxins, food toxins, environmental toxins. So your job is to keep your body as clean as possible, right? As well, sort out your mental and emotional triggers here as well. It's a bit of a complex situation, but you will get the hang of it, I know. So what are the natural supplements? Well, I would give a vitamin D3. You want to bring in vitamin C, vitamin B complex, especially B3 and B12. Talked about B9 and B5 as well. Quercetin, zinc, and magnesium. Wonderful, wonderful supplements which help you just to create a sort of healthy foundation in order to manage your asthma attacks. What are preventative lifestyle changes? Well, of course, avoid all irritants inside your home. Secondhand smoking, not so good here as well. Get rid of all these aerosol petroleum-based ingredients in your health and beauty products. Get a dehumidifier, particularly in damp areas, right? Fix all the water leaks and get the mold out of your bathroom for sure. Buy maybe a water filter, get the chlorine out of your water. Install, of course, flooring and carpets that you can vacuum beneath to reduce the dust mites. Wash your beds daily. Use the sheets and pillows that are sort of non-allergenic and don't contain, feathers, right? Just buy more a bedding which suits your needs. Of course, if you have furry friends, pets, maybe they have to stay out of the bedroom for a while. Did you know that cockroaches are another asthma trigger? So if you see them in your home, get a professional exterminator in. That definitely triggers for asthma. If you have spinal problems or spinal misalignments, you maybe want to check with your chiropractor. Because when you sit at the computer, which we all do for hours, we can sort of develop a sort of forward head posture where the head shifts sort of out in front of your body. And as a result, the nerves get sort of compressed, particularly in the vertebrae, sort of T1 to T4, and they compromise your lung function. So by retraining the spine and moving it back into its ideal alignment, the pressure is taken off the nerves, reaching out to the lungs, so you can breathe better. Of course, manage stress, right? Maybe start cognitive behavioral therapy to change your attitude and your belief system towards certain life experiences, or explore more stress management sort of techniques like breathing exercises, kundalini yoga, meditation, walking in nature, whatever works for you. Exercise and movement, I think, would be helpful here, although some children say that, the asthma is more triggered by sports, or let's say vigorous sports exercises. But in general, physical activity and dietary changes would be helpful here in order to just shift the toxin load within the body. Let's finish off this video with homeopathic remedy, my favorite subject always. But here I want to say homeopathy is a really safe science that offers a permanent healing for asthma. And not many integrative medicine methodologies can actually say that. It helps remove asthma from the very root. And these remedies set off the body's own restorative processes, mainly strengthening its natural healing system to make it strong enough also to fight the condition when external triggers come and set off an asthma attack. You have more of an armor inside you, natural armor, a natural defense system built with homeopathic remedies and then with other methodologies. They are safe, they're natural, they're free from any adverse side effects. And of course, they can be prescribed to all age groups, which is important here because we talk about children. If you have any questions or require guidelines about the suggested homeopathic remedies in this video, please contact my practice Medica Nova at health@medicanova.net, or of course your professional homeopath. Now, most suggested homeopathic remedies in this video are available at your local health food store or online. Regarding potency, I would suggest 30, which is the number behind the name of the homeopathic remedies. In an emergency for adults, I would say 1 tablet every 10 to 15 minutes until improvement sets in, and then you stop. For maintenance treatment protocol, maybe for adults 1 tablet daily or morning and evening, but please book your appointment for more individual treatment protocols, either with my practice Medica Nova, so I can help you to really shift your asthma attacks into a more enjoyable life, right? Rather than always fearing that this can trigger it off, this can set me off, as well as your children's health, of course. The first remedy is called Arsenicum album 30. It's really a top remedy indicated for asthma. So what are the individual key symptoms here? Well, it's a suffocative cough, it has wheezing involved, there's a shortness of breath. Often the asthma gets worse around midnight, and it's also treated well with this remedy when you feel anxiety coming on. Panic attack, right? You can't breathe, you want the windows open. Arsenicum album is definitely directly related also to skin rashes or eczema, which are connected to asthma, which I mentioned before. Wonderful remedy, great remedy in an emergency asthma attack. It really calms down the narrowing of the airway passages quite quickly. On the other hand, if you have asthma, which includes a dry cough, a really strong cough, it's a deep barking, hacking cough, like as if you breathe through a sponge, like this kind of feeling. The cough is attended with extreme dryness of all the air passages. There can be whistling from the chest on the inspiration. Respiration is very difficult here, and in most cases warm drinks maybe bring relief from the cough. The remedy would be Spongia tosta 30. Really helpful here, but it has to have this deep barking, hacking cough, as if you breathe through something like a sponge. Antimonium tartaricum is another remedy which we use for excessive rattling cough. So it's not a dry cough. You have here a lot excessive rattling mucus, which you can hear in your chest. And you feel like, God, my whole lung is full of mucus, but I can't bring it up, right? There's a lot of difficulty to raise the mucus up, the phlegm up, and to spit it out. Therefore, the respiration is quite rapid and difficult. Excessive suffocation is maybe observed because you feel like you are drowning in this mucus. And, people feel better when they sit up, whereas when I'm lying down. But it's a great remedy to open up the air passageways to actually, bring out this phlegm. Asthma in children, I mentioned, we have 2 remedies which we use quite successfully. It's called Ipecacuanha 30 and Sambucus 30. Now, both remedies are indicated for asthma in children, but Ipecacuanha works very well where there's this excessive cough with mucus, rales in the chest, and the cough is accompanied by suffocation, often a gagging response, right? Not vomiting, but this gagging response, shortness of breath and gasping for air. And the child may even become blue and stiff during the asthma attack. So Ipecacuanha is wonderful. Sambucus nigra is again indicated for asthma episodes in children as well. Often here the asthma attack is at night with cough and suffocation, but please contact me for further guidelines here. If your asthma is triggered by damp weather, and that also happens in children as well, Dulcamara 30 and Natrium sulfuricum, wonderful remedies here. These are the remedies which really sort of heal deep-seated asthma for sure. Can't praise them enough, these remedies. Anyway, the asthma is worse on damp weather. And with dulcamara, it's sort of a loose, rattling, asthmatic cough, particularly worse in damp weather. Person has a really hard time to expel the phlegm. Natrum sulfuricum is one of the most helpful remedies, where the cough is accompanied with thick, ropey, green phlegm. Works very well when you have asthma attacks at 4 a.m. or 5 a.m. early in the morning. And it's a top grade remedy in my arsenal for children having asthma attacks. Also, we have a remedy called Nux vomica 30 when you have asthma during the winter time only. The cough, is again related to wheezing, oppressed breathing, especially when it comes up in cold weather. Can be maybe the cough dry in the evening and at night, but loose during the daytime, so you can actually expel the phlegm, but during the night you sort of clog up. But again, definitely worse after midnight. And Nux vomica is a great remedy when your asthma is related to gastric ailments, right? When your digestive system is affected. So you see, it's a little bit of a complex picture, but with a practitioner who knows about these remedies and can guide you with the right lifestyle changes, you can tackle your asthma. We have other remedies where asthma is triggered by dust, right? Exposure. Blatta orientalis or bromium 30 would be a good choice here. Particular bromium is selected where the cough has this rattling, mucus, suffocation, and breathing after exposure to dust. Miners, for example, are really affected here, right? They breathe in all this dust, and these remedies can help our miners so much. Other remedies we have, of course, asthma in elderly, maybe carbo-veg is the remedy. Cough caused by variant triggers with asthma, we have Drosera, Coccus castus. Asthma which is worsened by cold air only, aconite, or even asthma only in smokers, which would be lobelia and flatta. But I don't want to give you the whole gist. I want to give you an idea that with homeopathic remedies and really targeting your individual symptomatology of your expression of your asthma, diet changing, lifestyle changing, you can heal your asthma. So I hope that this video, again packed with educational information and useful guideline, has inspired you to seek out more natural solutions. You can heal your asthma. If you have any questions about the suggested treatment protocols or the homeopathic remedies, contact my practice Medica Nova at health@medicanova.net. And don't forget to check out my website medicanova.net at the online academy, where you will find university standard home study online courses in homeopathy for the whole family. So if you really want to learn about how to use these remedies, homeopathy applied during pregnancy, birth, and postnatal healing. If you really are interested in learning about how to become a health coach, I have a great course, Integrated Health and Wellness Coaching. Or you want to learn about integrated mental health, what to do with depression, anxiety, Alzheimer's. Or you really want to dive into the subject of quantum healing, the relationship between your mind, body, and soul, and so much more. So check out these courses. They're certified. You can do it in your own time, in the comfort of your home. But they are high quality, packed with information, as I do in my videos, and I'm sure you will enjoy them. So take care. Much love. Till next time.